Coming up, the Health Secretary, Wes Streeting, has denied he has ambitions to be Prime Minister, which is handy, as he's enough to be getting on with running the NHS.
Hey, it's Sophie and Will from Sky News.
Too many headlines, too little time?
We get it, and that's why we're bringing you Cheat Sheet.
10 minutes every weekday morning.
All the big stories from politics to pop culture, minus the noise.
No doom scrolling, no spin, just the stories that matter from two people who live and breathe the news. Cheat Sheet with Bridge and Frost from Sky News.
Follow Cheat Sheet wherever you get your podcasts.
No doubt, if asked to mark his own report card, Wes Streeting would say he's doing a damn fine job. But how should the rest of us judge a health secretary? Well, if success were measured in column inches alone, the amount written about Wes Streeting's leadership ambitions this week would suggest he's doing just fine. The problem for Mr. Streeting is that, of course, it's not. Instead, far better to judge him on the promises he made. And there in black and white in the manifesto is cutting waiting lists. We've got fresh data out on exactly that.
The NHS is on the road to recovery. Waiting lists are now down by almost 250,000 since we came to office, falling for the first time in 15 years.
So we thought we'd take a bit of time and see whether the health service is being turned around. And with doctors about to go on strike yet again over pay, we'll be asking whether the Department of Health really is a springboard to Downing Street. Later, we'll have the verdict of Roy Lilley, former NHS Trust chairman and health policy commentator. But let's start with Sky's health correspondent, Ashish Joshi. Look, we've had some stats out today regarding the NHS, which I suppose you can link directly to Wes Streeting's success or otherwise as health secretary. What have you been learning?
We've been learning that Wes Streeting has had some success as the Health Secretary. When Labour was swept into power last July, Wes Streeting and Keir Starmer said they should be judged by their record on turning around a failing NHS. That was last July. The NHS waiting list is 230,000 patients lower than July last year. And this is hugely significant because Wes Streeting has been talking all the time since he's been the Health Secretary. Judge me by the waiting list. I will bring this waiting list down. But he hasn't had to contend with any industrial action. He hasn't had resident doctors going out on strike. He hasn't had a very difficult winter to cope with. But he has been talking about making efficiencies, clearing theatres to work round the clock, more diagnostics. All of this seems to have worked better because certainly as far as the figures are concerned, the elective waiting list, that big number, the one we always talk about, the number of people waiting for routine or planned care is coming down.
Is that enough? We've got a waiting list of 7.4 million at the moment. Dropping 300,000 sounds to me like a bit of loose change down the back of the sofa. It's not making massive inroads into the waiting list, is it?
No, it isn't. It's making inroads, but you've got to realise, Neil, that for years we've been talking about a waiting list that has been growing and growing. He's reversing that trend, or at least he has reversed that trend over the last 12 months, and that is hugely significant. All right, so when you're talking about millions of people, a few 100,000 might not make a dent on that figure, but it will make a dent on those few 100,000 people who are being seen in a timely fashion. So as a trend, it is going in the right direction. And then that's the key, because what was happening is that every month more patients were being added to that list. And we know, we've talked about this so many times, if you're a sick patient and your treatment is delayed, then you will become even sicker and you will need more treatment. So it's a vicious cycle that needs to be broken.
One thing that I thought had happened in the past 12 months, but clearly has not, was junior doctors, or resident doctors, as they're now called, being satisfied with the amount of money that they earn. I opened my newspapers this morning to discover they're off out on strike again for another 5 days.
Yes, they are back out on strike because they said when the dispute was resolved, when Wes Streeting came into office, he sat down with the resident doctors and he gave them a 29.8 bump, right? That pay rise, pay restoration. But what the BMA will say is, no, what he said is, this is part of the journey. This is part of the restoration. We're still over 20% behind and we want that money. It doesn't have to be paid right now, but we want an assurance from the government that it will continue to give us our pay rise so we are where we were back in 2008. So that amounts to over 20%, which as we know, the government simply doesn't have.
Yeah, I mean, look, I know what the Health Secretary will say about all this. I know what the BMA are saying about all this. I'm wondering what the public will say about another significant strike by resident doctors. But remind me, Ashish, our Health Secretary has been in the news an awful lot this week, and not necessarily because of the job he's been doing down at the department.
No, for all the wrong reasons. I think Wes Streeting does not need this added distraction. And then this is this plot that has been talked about to replace Keir Starmer as leader of the Labour Party. Wes Streeting has come out and said absolutely not him. Keir Starmer says he doesn't know where these leaks have come from, but he's had to apologise to his health secretary. A distraction that neither of them need right now, because at the moment, Labour, if you look at the polls, trailing behind Reform and really not getting their act together as far as the electorate are concerned, with this huge mandate that they were swept in with last July. And Wes Streeting wants to focus on what's going on in the NHS. Is he behind this attempted coup? We don't know. He says he's not. Keir Starmer says he's pretty satisfied that Wes Streeting isn't. But certainly there is something very wrong in this toxic culture that they've been talking about at the heart of government and in Downing Street.
Thanks, Ashish. Well, it might feel distinctly longer, but Labour have only been in power for less than a year and a half. How much could they have hoped to achieve by this stage of the Parliament? Roy Lilley is a health policy commentator, having been involved in the NHS since 1974 in a variety of roles, including Trust Chairman. Roy, let's rewind, if we can, to day one of this Labour government. Wes Streeting, the Health Secretary, what state was the NHS in when he entered the Department of Health?
Well, it was kind of in tatters, really, Neil. I mean, we'd just come through COVID, which had had a hell of an impact on the staff. And of course, we'd also forgotten that we'd gone into COVID after a period of pretty much flatline funding following the world banking crisis, which I know is a long time ago. But did these things affect the NHS over a long period? And for nearly 10 years, the NHS had under 2% of funding. It needs about 3.84% just to keep its head above water. So we'd gone into COVID and we'd forgotten that waiting lists were already at 4.5 million, and everyone was saying, this is a record, I can't believe it, how's it got like this? And also we had 40,000 vacancies amongst the nursing staff. Along comes COVID, all bets are off. The government just throws money at the situation, we struggle through and we come out the other side, and along comes Wes Streeting and inherits an NHS that he said was broken, which was hugely demoralising for the staff. I mean, they were trying to do everything they could to make sure it wasn't broken. So that was a stupid thing to say, but it was struggling, there's no question, and it's still struggling today.
What is your assessment of how well he has performed over, what is not yet even a year and a half in the job?
Well, look, to be honest, I think he's been a disaster. Streeting came in, he had one job. I mean, the government was elected on the basis of stopping the boats, fixing the economy, and shortening waiting lists. As far as the NHS was concerned, I thought he would come in and have an absolute resolute focus on cutting waiting lists. Well, he sort of started off by talking about it, and then out of the blue, with nothing in the manifesto, nothing at all, he suddenly said, well, we're going to merge NHS England with the Department of Health. And there are reasons for that. There was a certain amount of duplication, mainly in the Department of Health, not in NHS England. But merging those two, it makes sense. But that means the focus, the top team shifts. Then he said, well, we're going to have a 10-year plan. And, 10 years means nothing really to people working in the NHS. And then it's only a 3-year plan anyway, by the time it was published, because it will take us up to the election. On top of that, along came Lord Darcy's report and assessment of the state of the NHS, where he made it clear that it was underfunded, understaffed, the buildings were falling down. I mean, it was a horrible report. So suddenly, on top of all the pressure of doing the waiting lists, we've got all the distraction. And of course, the latest distraction is that we're going to lose half the staff in integrated care boards, and no one knows which half, and no one really knows who's going to pay for the redundancy. So it's chaotic.
But if you were listening to Wes Streeting this morning, I mean, the Department of Health are cheering the fact that waiting lists are coming down. But I suppose your point is they're just not coming down far enough.
Well, look, you can't argue the fact that they are coming down, but only, a tiny amount. But the fact is, first of all, we're going into winter, which is always a bad time for the NHS. And secondly, if you look at the numbers, about 1.5 million people join NHS waiting lists every month, and about 1.5, 1.6 million people get fixed up and are off the waiting list every month. So there's hardly any headroom at all. Yes, they can say waiting lists are coming down, but the trajectory, it's almost flat, really. And there isn't the impact that there's going to have to be if we're going to get back to the 18-week waiting list that the Labour Party have promised by the next election. If we keep this up, they stand no chance.
And when you dig into the data and you look at specific parts of the NHS, the picture almost becomes more worrying. Accident and emergency performance continues to be weak. If you look at oncology, 120 of the 123 trusts in England are still not meeting the target for patients to be seen and receive treatment within, I think it's 62 days. I mean, that is an abject failure.
It is. And, on a personal note, I had cancer myself last year. I had prostate cancer, diagnosed out of the blue. And I'm, very pleased to say that I'm cancer-free now. So I had a very good cancer experience. But, as you say, a lot of people don't. And the thing is that, time tied in cancer, wait for no person. And you have to get in, as fast as you can to get cancer diagnosed to get a successful outcome. But it's true of all of the specialties, the cardiac specialties, they're swamped as well. Everybody's waiting too long for everything.
First things first, Roy, great to hear that you're doing well. But just in terms, though, of the NHS's preparedness for winter, every year we hear from the NHS frontline, look, things are going to be bad, things are going to be disastrous, we're just not ready, we're not going to be able to cope. This year, more of the same.
I saw the first draft of the winter plan back in June. So the NHS has been planning this for a long time. However, you would probably have seen in the more general news that in Australia, they've had a horrendously bad bout of flu. And generally speaking, the flu season moves from Australia to here. And the indicators of what happens in Australia is a very good indication of what's likely to happen here. And all the medics and the chief medical officer is predicting that we are in for a really bad flu season.
We'll wait and see what happens this winter. But one thing that will sharpen people's minds about the Health Secretary are the ongoing industrial disputes. He came in, awarded resident doctors a significant pay rise, and once again they're back threatening 5 days of strike action.
I mean, there was a time when doctors just wanted a career for life, but now the young doctors want a life and they want a career. And I understand that. And of course, we say junior doctors and we all think, well, this is just a youngster out of university or medical school. They're not. These are very important people. And they do have pretty rotten time in some hospitals. There's no 24-hour food, there's parking problems, there's rota problems where they can't get time off and so on. So working conditions are poor. So the Department of Health have agreed a new 10-point plan to resolve that. Very sensible plan, thoroughly approve of that. It's not implemented everywhere yet, but it should be. And then, of course, we're left with the question of their pay. Now, they have an argument over pay restoration. They say that their pay's been eroded over time by inflation. There's an argument about how it's calculated, but whichever way you calculate it, you can see that it has been eroded.
Everyone understands that. It's the 5 days of strike action that will inevitably lead to poor health outcomes and deaths that sticks in people's craw.
I mean, I remember when they first said that they were going to go on strike, and it was a jaw-dropping moment. Nobody ever thought, doctors would go on strike. I mean, I don't know how Streeting's going to handle this. In my view, Streeting has been really almost mimicking what happened to Steve Barclay, the Tory predecessor that he had, who handled the first junior doctor strikes before the election. And Streeting was very critical of Barclay. He said, you should negotiate, you should go to ACAS, you should keep talking. And of course, everything he criticised Barclay for doing, Streeting has done himself. He's been very belligerent and very tough, and that doesn't help. My view is he should go to ACAS. I think he's got to the point now where he probably can't settle this because everybody's dug in. And I think that going to ACAS, which are the independent arbiters of industrial disputes, might at least get them back round the table, because nothing happens until you talk.
Let's kind of get your final thoughts on Wes Streeting. And look, there are years of this Parliament left to run. But I'm wondering, as of this point, on the record that he has shown as Health Secretary, do you think Wes Streeting would make a good Prime Minister?
No, I really don't. I don't think he has the mature judgment that's required to do that very difficult job. I mean, we've got a managerial style Prime Minister now. He doesn't have that kind of charismatic personality that makes a Prime Minister. Streeting has, I think, the charismatic presentation and the articulation where people do listen to him and quite admire him. But if you actually look at the decisions he's made and dig into his judgment, I don't think he has the mature judgment that I would want to see in a Prime Minister.
Roy, been a pleasure chatting to you. Thanks very much for your time. And that's your lot for this edition of The Daily. We are back again tomorrow. Till then, take care.
Hey, it's Sophie and Will from Sky News.
Too many headlines, too little time?
We get it, and that's why we're bringing you Cheat Sheet.
10 minutes every weekday morning.
All the big stories from politics to pop culture, minus the noise.
No doom scrolling, no spin, just the stories that matter from two people who live and breathe the news. Cheat Sheet with Ridge and Frost from Sky News.
Follow Cheat Sheet wherever you get your podcasts.